It's only early November, and hospitals across the country are seeing a surge in patients with respiratory illnesses, specifically flu and RSV.
Here in Hampton Roads, doctors at CHKD tell us they are dealing with the spike also. Sarah Hammond explains why they are asking patients to screen their children before bringing them in.
Leaders with the Children's Hospital of the King's Daughters say they are seeing a surge in patients they haven't seen since some of the highest peaks of COVID-19.
It's affecting our emergency rooms, our urgent cares, our pediatric practices.
The culprits, flu, COVID-19, and the main player, RSV. According to the CDC, RSV infections have spiked almost 70% over the last 4 weeks and are appearing earlier than usual. CHKD says the reason for the increase is young children who were sheltered from common bugs during COVID lockdowns are now encountering viruses their immune systems might not be prepared to fight. However, Chief Medical Officer Dr. Christopher Foley says just because your child is sick doesn't mean you need to rush to the ER.
These patients are often not that sick. Many times they can be cared for at home.
Dr. Foley says the keys for treating patients at home are lots of fluid, rest, and things like Tylenol. However, he says if your child starts having difficulty breathing, starts turning blue or gray, starts having pauses in their breathing, high fever, difficulty staying awake, or refusing to eat or drink, that's when you should head to the ER.
Hospital leaders emphasize the sickest children will be seen first, no matter what order patients arrive in.
You may have to wait a long time to be seen.
Along with a surge of admissions, hospitals, including CHKD, are still dealing with staffing shortages, so they are asking for patience. Reporting in Norfolk, Sarah Hammond, 13 News Now.
And so we know cases of RSV and the flu are climbing, but what about coronavirus? Here's where the numbers stand in Virginia tonight. The health department reported almost 1,200 new cases today. That's slightly higher than the current average. Across the state, 481 people are in the hospital with COVID right now.